On behalf of Senator Lautenberg, the Congressional Lupus Caucus, the lupus community, our co-sponsors for this event, the Alliance for Lupus Research and ARDA, the American Autoimmune and Related Diseases Association, and the lupus community, we welcome you to this briefing and the opportunity to hear and learn about lupus. So when I start to talk about lupus, I always think about why should you care? We believe you should care because there are a lot of people with lupus. We estimate 1.5 million, but to be frank, no one knows how many people have lupus because the disease is misdiagnosed, undiagnosed, and those numbers are much bigger than anyone has been able to count.
I can tell you from firsthand experience that lupus is extremely complex, difficult to diagnose, potentially fatal, presently incurable, totally capricious, painfully limiting, life-altering, dream-stealing, career-ending, and financially, emotionally, and physically devastating.
So let me tell you a little bit about this disease, because when you walk out of here and people say, well, you went to a session on lupus, what is that? Lupus is an immune system disease, but the immune system is misguided. It's misdirected. It's protecting you, but it's also attacking you. That's sort of strange that it would do that. Why would it do that? So lupus affects various parts of the body, like you get hair loss, sensitivity to the sun, where you get actually a rash or sick from the sun, painful swollen joints, fevers, kidney problems, rashes, and a lot of fatigue. The Lupus Research Institute has stimulated enough basic research that we need to move forward. We just need the funding, because the scope and the pace of recent discoveries is quite exciting.
10 years ago, I lost my younger sister to lupus after her 25-year battle. Our whole family is really dedicated and committed to finding a cure for this terrible disease. We don't want what happened to my sister to happen to anyone else.
My message is one of optimism and hope. If we can keep our current momentum going. So lupus is a special disease. We refer to it as the prototype autoimmune disease, meaning that it is everywhere and can be considered as representative of many different autoimmune diseases. It's been really a remarkable about 15 years in my mind, really a golden age in lupus research. The pharmaceutical companies are terrific and are working very hard to bring new drugs to patients. But they leave it up to us in the academic centers and the research institutes to do that groundwork that is the basis for the drug development that they do. It's up to all of us around the country to encourage support for the NIH that will keep these great advances that I really believe are very, very significant going.
I just urge everyone here who is in a position to change policy, to affect research, to hear everything that we're saying here and just push forward and keep working, and don't give up on things that don't give up on this process here.
My take-home message is there are health disparities in lupus, as in so many diseases, and we can and must do something about it. In fact, minority populations do not have a worse outcome from their lupus because of their genetic endowment. And in fact, even their risk of developing lupus is part because of their genetic endowment, but part because of other triggers that may be important in the combination of genetics and environmental triggers that lead you from a predisposition to a frank disease may be more prevalent in minority communities. And some of these issues can be addressed within the patient and physician bond and patient and physician advocacy groups and patient and physician education. We need to recognize that stress, poverty, access to health care, these are all public health issues. And in the end, we pay for not addressing them early on. But the good news is this is a situation where doing the right thing is also cost effective.
These are public health issues. These are research issues. No new treatment approved. Actually, one new treatment ever approved, ever by current FDA statements, standards. So really, only one treatment ever has been approved for lupus. That's the reality.